Hi ladies and gentlemen, it's Dr. Julian Avoa. I was asked by one of my followers from the Filshie clip group to talk about Filshie clips and how they're placed and what's the problem with placing them. First of all, I would never place a Filshie clip because of their abhorrent failure as far as falling off of the fallopian tube. Second of all, that they do cause a foreign body reaction in a significant number of patients. And number three, the reason that Filshie clips are so popular, it's simply because it's so easy for the doctor and so fast for the doctor to do the procedure without really taking into consideration how well the procedure works and whether or not there's any complications to that particular procedure. So I'm just going to take this little model and I'm going to suggest that either by laparoscopic procedure or through open procedure, you place the Filshie clip approximately 2 centimeters from the uterus in the isthmus portion of the fallopian tube. Now this is a standard size fallopian tube, average size, but what is common after delivery is that the fallopian tubes appear rather swollen. And so when you try to put a clip on this particular tissue, it can fall off. That's why many doctors will place multiple Filshie clips on a fallopian tube, hoping that it won't fall off or hoping that it'll work properly. So if 25% of the time, however, when you place these clips, similarly with the Holka clips, you place these on the tube, they're going to fall off. Now, what you're expecting to happen is that they compress the fallopian tube so hard that they scar the fallopian tube and destroy the lumen so that there's no passage of sperm and egg together. That's how they work. So it doesn't matter if the Filshie clip falls off as far as sterilization is concerned, because in the majority of cases you will have sterilization. The problem is you're going to have a Filshie clip that's floating around the pelvis, that's causing a foreign body reaction, that's causing problems such as erosion into the intestines or into any other associated organ. And this can cause chronic pelvic pain, chronic abdominal pain, and also the foreign body reaction such as the Asia effect. So it's so important to understand that in general, I don't even know why doctors are still using Filshie clips, because first of all, if you're not getting informed consent talking about the foreign body reaction, then you're below the standard of care in my opinion. And it's so important for patients to understand that generally speaking, doctors are placing Filshie clips simply because it's so easy to do, it saves them a lot of time, but it doesn't necessarily mean that it's a better technique. As a matter of fact, it tends to be very inferior. And don't forget about the post-tubal ligation syndrome associated with Filshie clips. Thanks so much for watching. Take care.